Good evening, everyone. Welcome to Beyond Telehealth. And my name is Dr. Lisa Finkelstein. And this evening, we are going to be talking about teleurology, which is near and dear to my heart because I am a urologist. And we're going to talk to my good friend, Dr. Dawn Bodell. And Dr. Bodell and I trained forever ago in Michigan. So welcome, Dawn. It is great to see you. How are you?
I'm great. Thank you, Lisa. It's definitely a new world. Thank you for the opportunity to see you on internet.
I know, on social media, whatever that is. So, Dawn, let's have you introduce yourself. Tell us what specialty you practice in urology and where you practice.
I'm Dr. Dawn Bodell, and I'm a urologist that's fellowship trained in pelvic reconstruction and voiding dysfunction, and I practice in the Springfield, Eugene, Oregon area.
Okay, and were you using telehealth prior to the pandemic?
What? Prior to the pandemic? Yeah, no. It was definitely the pandemic that lit the fire under our keister to jump into it.
Tell us how you got started and what platform you're using now and what EHR are you using?
Now we are using Doxy. We find it very easy to use for both patients and staff. And our EHR is Centricity. So the two are not linked, but it's very easy to do with two different screens in your office. And it's made things really, I think, pretty easy. It's made things more timely and efficient because I'm no longer waiting for my elderly patient to take the time to walk back into the room, get the vitals. It's definitely more efficient.
So you are a pelvic floor specialist, and you deal with a lot of women and elderly or older women. What are some of the challenges with using telemedicine? How do you examine a patient, or how do you use telemedicine?
I don't use the telemedicine per se for an exam, obviously. That would be a challenge. Pick up your skirt. No, it's not going to work. However, it is great for gathering information, the initial consultation, because with these incontinent women or prolapse, they're going to obviously need an exam at one point in time. So they will come in for a visit for the complete physical cystoscopic evaluation. Maybe it's for their urodynamic evaluation. And then once I have that information and all of their studies are complete, I do their final consult to talk about surgery or other options on the telehealth. So I use it front and in the end.
And I'm sure patients appreciate that they don't have to, go in to see you for these other little visits that might take 15 minutes when, you were telling me that they live potentially 4 hours away from you.
Right. The drawing area in this region is huge, from the coast to Southern Oregon and everywhere in between. So it definitely helps these patients from an economic standpoint of not needing to miss a day of work. So for that, it's a plus in and of itself. And I just find it more efficient because everything's at my fingertips. And whether it's drawings or whatnot, you can still do everything for them right during the telehealth visit.
Do you think that whenever the pandemic goes away, that you're going to keep using telehealth in your practice?
At this point, I'd say yes. We actually are still continuing to ramp further as we better understand how it can be used.
Okay. So we're at 5 minutes and we're supposed to do 5 minutes with the Fink, but let's leave everybody with a funny telehealth story.
Probably the most unusual one was a new patient consult, and it was for incontinence. However, she did meal prep and didn't feel she needed to sit down, so promptly set her cell phone on the chopping block while she proceeded to all I could see for the visit was a huge cutting knife and vegetables, as she told me, "Oh, well, I'm meal prep." And I'm like, and I thought I was the surgeon with the knife, but apparently not.
So the lesson, and this is a common theme that I hear from physicians, is that patients don't really understand that this truly is a physician-patient visit, and chopping vegetables during a visit is just not what we're supposed to be doing when we're talking about your pelvic anatomy.
Absolutely.
Well, Dawn, this has been great. It's let's see, we did 6 minutes. We're getting better.
Hey, thank you, and thanks for the opportunity. So great to see you, Finky.
It's great to see you too, Dawn. Take it easy. Talk to you soon. Okay.